Welcome to the Metabolic Link, a medical and science-focused podcast that explores the common thread of metabolism in health and disease. This is where science meets society. Welcome to another episode of the Metabolic Link. I'm your host, Victoria Field, and today I have not one, but two incredible guests on the podcast who are going to be discussing their battle with bipolar disorder, but also how they've been able to thrive using ketogenic metabolic therapy, and now how they're helping others through the process. So my first guest is Matt Baszucki. Now, Matt Baszucki was diagnosed with bipolar disorder type 1 when he was only 19 years of age, and says he's achieved full recovery in using the ketogenic diet. Since then, his family has been speaking openly about their experience and success in using ketogenic metabolic therapy, and they've really now dedicated their lives to helping other families do the same. And they're doing that through a variety of ways. So they've got the Baszucki Brain Research Fund that's supporting mental health research involving metabolism, involving ketogenic metabolic therapy, which is so exciting. And they've also started a nonprofit called Metabolic Mind, which is dedicated entirely to providing education and resources all around the emerging and exciting field of metabolic psychiatry. My other guest is Dr. Iain Campbell. Now, Iain Campbell has a PhD in global health from the University of Edinburgh in Scotland, and is a principal investigator on a pilot trial that's actually being supported by the Baszucki Brain Research Fund, all involving a ketogenic diet for bipolar disorder at the Division of Psychiatry within the Center for Clinical Brain Sciences. Now, Dr. Campbell has actually been suffering from bipolar disorder type 2 himself. However, he's experienced great benefits in using ketogenic metabolic therapy over the last 7 years and is now thriving. Both of these incredible human beings are also going to be speakers at Metabolic Health Summit 2024 in Clearwater Beach, Florida, January 25th through the 28th. You will not want to miss them speaking and what they have to share, because both of them really provide incredible insight in their unique experiences from being a patient all the way to Dr. Campbell's research and what he's doing in the mental health field to really make some big changes happen through his work in bipolar disorder. So it's my absolute pleasure to be able to introduce Matt and Dr. Campbell to you today, and I hope you enjoy this interview as much as I did. Matt Baszucki, Dr. Iain Campbell, thank you so much for joining me today for this discussion. Really, really excited to not only be sitting here with you right now, but to also have you both as speakers for Metabolic Health Summit 2024. Thank you guys so much for joining me.
Sure.
Thank you for having us.
Yeah, so, you both have really interesting stories, and the fact that you've been sharing now for, I want to say it's been like a year or two, you've been sharing publicly about your own struggles with bipolar, but your journey through in finding ketogenic metabolic therapy, and now helping people in your own ways in the world, which is pretty, and together as well. You've got this incredible podcast called BipolarCast that you actually have together. And Iain, Dr. Campbell, you're doing research. And you've also got some incredible work happening with your family, Matt, with Metabolic Mind. And I would love to dive in from sort of start to finish, kind of like reel it back a little bit, because it starts from a very personal place, just the good work that you guys are doing in the world today. So maybe we start with, from your own perspective, let's talk a little bit about bipolar, and let's talk about, from your perspective, what it is, maybe what, type you've been dealing with over the years, and how it all started for you both. I don't know if one of you wants to go first, maybe Matt, we'll start with you, and you can kind of lead us into then your story from there, Iain.
Sure thing. So for me, what bipolar disorder is psychiatric, metabolic dysfunction manifesting as psychiatric symptoms. And I can talk a bit about my story from the start and what happened to me. So when I was 19 in 2016, I was a freshman in college. I had my first psychotic break. I was a second semester freshman. And my life had been pretty crazy the last year. I'd pledged a fraternity. I was drinking a lot, using marijuana, not sleeping well, eating carbs. So it was like a perfect storm, as it were. I was stressed. I was taking a hard curriculum at Berkeley, doing some engineering stuff. And I went into manic episode, psychosis, was hospitalized, delusions. A lot of my psychosis related was around spirituality and enlightenment and different things like that. And so I was hospitalized for a week and a half at Stanford, and I was put on an antipsychotic, and I was taken off it a bit too quickly, and I had another break that fall. And so the short version of the story is, for the next 2 years, I would be in and out of psychosis, never truly well. I tried dozens of medications, dozens of doctors, treatment centers all over the country, could hardly function, couldn't go to school, couldn't work. I was homeless at one point for a couple of weeks, just running away from my family. It was really difficult. And in 2019, so this would have been, 2018, this would have been a couple of years after, I had a bit of insight when I realized something was very wrong with how I was living the last couple of years. And I had been hospitalized 4 times at this point over the 2016 to 2018, each for a period of about 2 weeks, and each for psychosis, hardcore psychosis and mania. And I was heavily medicated, but I realized something was wrong. And I was at a treatment center at the time, and I started to put together some healthy habits, started to get a little bit better. And it got to the point where I was doing frequent exercise, sleeping pretty well, doing everything, as I should in 2020, but I wasn't well. And I was still constantly battling the manic episodes that would come on. And the pattern was, and I'll try to be brief so we can get to more stuff, but the pattern was I'd get manic, I would start to sleep less. I would have to take extra Zyprexa antipsychotic medication. And I was constantly tracking my sleep, tracking my mood, pretty meticulously trying to figure this out, but I just couldn't manage it. I would always just get manic, especially March, when the days are getting longer very rapidly. Lucky break, Mom stumbled upon Dr. Chris Palmer's work in ketogenic therapies for mental illness in 2020, late 2020. I went on the ketogenic diet January 4th of 2021. And I went on it hardcore, and I tracked my ketones. And by March, when I went through the month, I call it March Madness. Everyone gets manic in March. When I went through the month with no symptoms, no psychotic symptoms, and no symptoms of mania, on 5 milligrams of Zyprexa, where previously I would have to take up to 20 to even just stay stable, I knew something miraculous was happening.
Wow.
My mom more or less stopped writing in her log that summer because I didn't have any symptoms. And it was almost like the illness had disappeared, and I didn't have to manage my mood by taking extra medication. For the first time, I could just take the same dose daily and I was fine. I didn't have these manic episodes. And it's really it's the closest thing to a panacea that I've ever encountered. I mean, keto was the solution for me, specifically getting into ketosis and getting the ketones up in the 1.5 and above range for those first few months. And so I literally went from not being able to function to everything just fell into place when I went and I was in ketosis, job. I had a girlfriend for a while. I was able to live normally. I stopped drinking, stopped doing drugs. And now it's I don't really experience the illness like bipolar disorder per se. It's just a normal life. And I do a lot of other things, exercise, watch my sleep. But really, keto's been a miracle for me. And that's the short version of the story.
Wow, that's pretty incredible. What was going through your mind at the time of this massive shift that I'm sure you felt within, your whole outlook on life? I can't even imagine what that was like.
Yeah, it was like I was able to see clearly for the first time almost. I mean, I had concrete metrics of, especially watching my cognition come roaring back when I went into keto, like my chess rating. My chess rating came roaring back, and I was able to work, and my executive functioning came back, where I was able to manage my life and handle things normally. And these are things that a lot of people with severe mental illness can't manage. So handling the normal necessities of daily life and planning things and attending appointments and working and all these different things. And so for the first time, I was able to do it all. And it really felt like just the ketones in my system just cured me.
Wow.
I can even dip out of ketosis now, which I do sometimes Tuesday through Thursday when I'm in the office. And then I come back in the weekends and it's not a problem. And I have suspicions that those few months of being in ketosis hardcore might have even like cured all of the metabolic dysfunction I was having. But compared to the meds, I mean, being heavily medicated, what a nightmare. And even the metabolic side effects that can come from a lot of these medications, right? What could have been potentially doing more harm than good to me. And I'm grateful for the antipsychotics, Zyprexa in particular, which I needed in those acute states. So I think there's tremendous value in medication. I wouldn't advise anyone come off their meds in 3 weeks doing keto. I'm coming off my meds very slowly on a ketogenic diet. But yeah, I mean, it was like a whole new experience of life for me.
Yeah. Wow. That's pretty incredible to go through. And I can't imagine. And life, I mean, as you probably know it, from 2021 to now has completely changed, it sounds like. And you've essentially gone into remission, if you'd call it that, since then, which is amazing. I mean, even today, I know you were mentioning, is it kind of a big milestone day for you in terms of kind of weaning off and, feeling back to yourself. And thank you for sharing that, because it takes a lot of guts, and I want to get into that whole side of things as well. But Dr. Campbell, you've experienced this yourself as well, and also have been through, I believe with type 2 bipolar disorder, you've also had your own journey through this, and you've now kind of branched out into researching about this, specifically as it relates to metabolism. So I'd love to start with you for, in terms of how it kind of began and how you kind of have shifted gears yourself, with your story.
Yeah, so type 2 bipolar disorder is like the really bad sequel to type 1. It's like the one they shouldn't have made. It's like you're 80% of the time depressed, you're 20% of the time up and able to function, but then during much of that time you're kind of manic or in hospital. And so it's really kind of like a more depressive version of the illness. And both are equally challenging in different ways. My challenge with it was primarily the depressive side of it, being unable to function for very long periods of time when I was growing up. And this but the kind of bipolar depression is not like normal depression. It becomes like catatonic depression, where you can't move, you can't leave the house, your whole body feels like it's on fire. It's a very painful thing to experience, and it actually takes stamina to survive the depressive episodes. So it's not like a kind of, you can really just rest through them. It's like your body's really struggling in the same way that you would feel if you were finishing a marathon or if you were exhausted from a long workout. And they've actually measured lactate levels in the blood of people with bipolar disorder, that when they're going through these depressions, the body is really struggling to survive. So when you're in these very deep states of depression, the suicidal thinking is very rapid, and it comes quickly because the body is in this physiological crisis state and it doesn't know what to do about it. And the kind of you can have the most wonderful life in the world with everything going well for you and a wonderful family, which I'm fortunate to have, but you still think constantly about suicide because your body is struggling to live. And unfortunately, I lost a family member to suicide because of this. He had young children, and it was just very difficult to witness this happening. And with all the modern treatments we have for bipolar disorder, still a quarter to almost 2/3 of us, 25 to 60% of us attempt suicide. So even with the best medications in the world, there's still a quarter to almost 2/3 of us don't want to live. So there's something very wrong with how we're managing this illness. And I experienced that firsthand through falling into very deep catatonic depressions. And the kind of trigger for me was I really wanted to start a family with my wife, and we were talking about this. And I really realized this is not going to happen for me. Like there's no way that I can look after children. And my wife kind of understood this, and my family understood this, because I'd always fall into these episodes, and it was just extremely depressing. And I was kind of very suicidal at the time, because I felt, just like useless as a person in lots of ways, not because I couldn't work, I couldn't have children, I couldn't function as a family member, I couldn't, all the things that were personal to me, that were important to me, that I couldn't fulfill them. So there was no future for me. So I just decided I'm just going to try everything I can to do everything I possibly can. Like, I'm going to try and turn every dial that I have available to me. And one of those was losing weight. I was about 60 pounds overweight. I did the Atkins diet very strictly. And I didn't know what was happening at the time, but within the first week of doing this very strict Atkins diet that was essentially a ketogenic diet, I was sitting on the bus and I felt it was like I felt like it was like I was on this black and white TV that was all fuzzy and out of focus, and suddenly I was seeing like color like on the screen for the first time. And the way I was experiencing that was looking at nature out of the window. I was experiencing like just contentment looking at nature and positive feelings. And I thought, like, I wonder if this is what people normally feel like. I'd never, like, for years and years, I hadn't experienced this. And gradually I started feeling better and better throughout the coming days. And just small things were making me feel happy, like interacting with people. And I thought, oh, I bet this is what it's like for normal people. And it's something actually someone on our pilot trial said is like, oh, I bet this is what it's like to feel normal. And it was really like the lights in my brain were completely off, and they were like, it was like they were just like clicking back online. And this is what convinced me of the energy component to this. Was it really felt like a city grid that had no lights on, and they were clicking back on, and my brain was just starting to function again. So I didn't realize it was ketosis at the time. It took me a few weeks to figure out that this was what was causing it, because I started to take MCT oils and track my ketone levels. And then my wife was saying I would take like an MCT oil supplement when I was out of ketosis. And within, I take like 2 or 3 tablespoons, and much like people have experienced with Alzheimer's or mild cognitive impairment, she would say, like, you seem like a different person, like to what you were 45 minutes ago. Like, you really seem different, like you're interacting more, like you seem happier, like you're not ruminating. So that was what got me, like, and from that point I was just completely sold. I was like, I've lost people to this, and I felt like I wasn't going to survive it. So I was like, I'm going to spend the rest of my life 100% just focused on whatever this is and how we can communicate it to other people. And that was what led to me going back to university and eventually doing my PhD, and then spending about 5 years trying to apply for funding to get this. Nobody was interested. And that was how I met Matt and Jan and the Baszuckis, and they were the first people that had applied to every like traditional funder, and no one was interested. And they funded our pilot trial at Edinburgh University, which is leading to, I think it's fair to say, like a massive shift in our university and how we view bipolar disorder. And I'd love to share more about that during this interview.
Absolutely. Well, I definitely want to dive into that for sure. It's really, really exciting research that's going to be underway, and the fact that you were recognized by the Baszucki Brain Research Fund, and now 4-year fellowship at the University of Edinburgh is really exciting. So I certainly want to dive deep into your research and what you're doing now, because I think it's going to make a huge impact, as well as, the research, the other research that Metabolic Mind and the Baszucki Brain Research Fund is supporting, that it's incredible where the field has the potential to go, I think, and it's just really starting to explode, which is exciting. So when you guys first started, just to kind of keep things on thank you, by the way, for sharing that personal story. I can imagine it's never becomes easier probably to share that out. I mean, you guys can speak to that in terms of at what point you sort of decided, you know what, I need to share this with the world. I'm sure when you've been suffering for so long and you find something that completely shifts your life, you might want to share it with the world, but it doesn't come along with, I'm sure, a lot of nervous feelings and all kinds of stuff, because as a society, there's unfortunately stigma around this, right? Which we need to break. So hence why we're doing this interview, to talk more and more about it. But what for you both was sort of that turning point where you're like, okay, we've got to do something. We got to shout this from the rooftops. And did you make sort of this big, like, okay, I'm going to share this publicly now? Because that had to be a big decision, I'm sure, somewhere along the way. I'm not sure. Matt, if you want to maybe start.
Sure.
Yeah.
So this is a good question. Unfortunately, a lot of my episodes were very public. I was making YouTube videos documenting my homeless expedition across California. A lot of people saw these. At one point, I videotaped myself flushing my lithium down the toilet of a Greyhound bus and posted it, I think, on Snapchat. It was kind of like a micro Kanye West breakdown, if you will. So it really sucked. And then when I met Iain, and I think we had the idea to just film my story, we had the idea to try a podcast, and we said, well, for the first episode, why don't we have Iain film me, interview me, and we could film it and see how it goes. And so I felt confident doing this because at the time I was in keto, this would have been 2021, the recovery was so robust. I didn't feel like coming forward about my illness was going to impact me negatively in terms of the opportunities I would have going forward in work or otherwise. And because the recovery was so robust. Yeah. So I felt so good, and I felt confident that if I just continued to adhere to this diet, I would be able to accomplish things that any like normie, as it were, would be able to, any person without a diagnosis. I think in some ways, being so strict with my health protocol has like catapulted me into almost like better health than some of my peers, just because I had to be so strict, and then I blasted through it. But to answer your question, yeah, for kids who are really suffering with this illness, I think it's important to share the nitty-gritty details of the story so that they can relate to this and understand that, yeah, I went through a lot of the things that these kids are going through, like horrific, life-altering mental illness. And then I recovered with the ketogenic therapy, among other things, circadian rhythm management and exercise and a good community and things like that. And I'm recovered, and I'm living a normal life, happy and fulfilled and content now. It's just beyond me. I mean, I can't believe it sometimes, what this diet has done for me. So it's important for me to share the story so that people can understand that, oh yeah, wow, he actually went through this. And so when I decided to share the story initially, it felt like my own feelings were irrelevant, because what really mattered was there are so many people who are going through this stuff for whom sharing the story could help them tremendously. And so if I had any reservations myself personally, I put them aside immediately. And I just said, look, this is such a remarkable thing. I just have to share it. And so that's why I decided to come forward. I don't know if you have anything to add, Iain.
Yeah, it was the same. Like bipolar is, you're kind of told that it's just going to probably get worse throughout your life, and then it's very like bad prognosis for most people with bipolar disorder, unfortunately. And I'd seen it in my family, like where mental health can go down that road, and to be functional and to be able to do normal things and to enjoy life, and like it's just completely, very, very few people with bipolar ever get to that. So to experience that, I just felt like I absolutely have to tell people about this. So initially I did this anonymously. I set up a Reddit account, and we have a Reddit like subforum called Bipolar Keto, and I just post and I'd write to just everyone that I could possibly tell about this and try and spread awareness, and occasionally some people would reply positively, and I would recommend them to Shabani's trial at Stanford. I think I'm the only person that's recruiting, trying to get people into other people's studies, because I just wanted everyone to experience this. And so some people joined Shabani's trial, and actually we were at ISBD, the Bipolar Disorders Conference in Chicago last week, and we were sharing some results, including one of the people who ended up joining our trial. But yeah, I just felt a responsibility, I have to. And the first time I shared about it was on the podcast with Matt, because I felt like I was basically on my own with my father. My father was a huge help and support to me, and he was the one that kind of kept me alive through all these episodes. And he also is involved in our research, and he's been incredible person. He's a professor of medicine, and so he's been really someone that helped me survive this. And so he was the only person I really told, and my wife and a few other people. And then when I met Matt and Jan, I felt like, oh, here's amazing people that are willing to be open about this. And I was kind of taken aback. I was like, oh wow, you guys just talk about this. And then it just gave me confidence to think maybe I could be okay if I did that as well. And it's turned out to be really positive. There are some people who don't understand, and there's some people who just kind of don't get it, and that's fine, and you can't do anything about it. But for the majority, I've just found really great people who do understand it and want to engage with it, and that's been wonderful.
That's great. And what an amazing thing you're doing for so many other people suffering out there, probably in silence, who don't feel like they can share, but then they see the two of you, maybe they've been along with you, Matt, since the beginning, right? And they're now seeing you on camera and how incredible and amazing you're doing, thriving at this point. That's a huge deal, just in you guys sharing your personal stories. And now also, of course, the work that you're doing, which I'd love to get into. I know you've got some great research going on right now. You're working with your dad on this, as well as some other incredible researchers, and it's specific to bipolar, as well as the threat of metabolism within mental health, which is going to be incredible. And of course, supported by Baszucki Brain Research Fund and Metabolic Mind. So please share a little bit more about where things are at with that. I know it sounded like you've got some maybe initial results so far. Would love to hear more. And I'm sure you're going to share even more at Metabolic Health Summit 2024, but maybe we give folks just a little bit of insight into what you're doing.
Yeah, so we completed a pilot study, and this was 20 patients going on a ketogenic diet. And this was, like I was saying, we've been trying to get this funded for a very long time, and nobody would even look at it because there was no pilot data, there's no case studies. So the Baszuckis made this possible, like from the start. This is why we're able to do this, which I'm incredibly grateful for, because nobody else would even take a look at it. We went to every traditional place, and so this is like it's accelerated learning about bipolar disorder in a way that I don't think any of us could have expected at the time. We had 20 patients go on ketogenic diet, and I presented the preliminary findings at International Society of Bipolar Disorders 2 weeks ago in a panel with Shabani Sethi and Georgia Eads and Danny Smith, who's our chair of psychiatry. And I think it's fair to say, without giving away all the results of the study, the reception was really warm and open and excited about this field, because for the first time we're showing real results in real people of what this can do for people. And what I will share, and I'll share at Metabolic Health Summit our full results of the study, but I can share some of the patient testimonials with permission. I shared a video of a person who was on a trial who was describing that this has completely transformed the quality of my life, that I'm able to do things I never was before, that this this has made such a big impact on me. I want to spend the rest of my life training as a dietitian to tell other people about this. And I shared another, which was a letter from the daughter of one of our participants, and she was sharing that her mum is back for the first time, that she hasn't had a mother because she's been so unwell, and she has a mother again. And these are obviously like why you do these studies, to get these kinds of results. And it's quite it's quite remarkable, what this can do for people, because you don't see these kinds of responses in trials typically, and not everyone will respond like that with any drug or therapy, or there'll be people who respond very strongly like this, and there'll be people who respond somewhat, and people who don't, like in epilepsy. But for the people who do respond, it is quite remarkable. And we also saw across the board metabolic improvement in our subjects. So we saw the weight reduction, the BMI, and cardiovascular risk is a huge problem for people with bipolar disorder. There's massively increased risk of 2 to 3 times the risk of type 2 diabetes and heart disease, and cancer is also much more prevalent in the bipolar population. So the first question that we answered was, can people stick to this diet? And we took their ketone levels every single day, and we asked them about their mood and their energy and so forth. And we have published some basic findings on the adherence rates, which are that 91% of the time they were in ketosis. So people 91% of the time were adhering to this diet, and they were finding it manageable, and they enjoyed being on this diet, which is something that we didn't know with bipolar, would they even be able to do this? And then we showed, and I have to not give away the full findings, but we found basically that this was having an effect on their mood symptoms and on their anxiety symptoms, impulsivity, so forth. But we also did in-depth brain imaging. We did MRS brain imaging, and we scanned 3 different regions of the brain. And what we found, I found to be one of the most interesting findings in bipolar research to date. And I've just published a preprint that's not our findings, but it's my thoughts about this general area. It's called, you can find it if you Google metabolic overdrive, hyperglycolysis and glutaminolysis in bipolar disorder. And I think we're actually starting, the thing I'm possibly the most excited about from this research is that we have this treatment for epilepsy that is now showing effectiveness for bipolar, and we treat bipolar with epileptic medications, anticonvulsants. And so to me, this is too much of a coincidence that we're seeing the effectiveness of ketosis, which is a therapy for epilepsy, in a condition that we manage with epilepsy medications. But I think what we're starting to see actually is the underlying, some very early indications of the underlying mechanisms at work here. And so we'll be publishing our findings in the next month or so. And I think people are very interested to see this because it's not just that people are reporting they're getting better, we're seeing it in their psychometric measures, but we're also seeing some mechanistic insights into why this might be happening. And so we presented this at ISBD alongside Shibani in Georgia, and they also were finding similar results in their patients, substantial benefits across psychiatric measures, metabolic improvements. So this was really wonderful to present this at the main conference for bipolar disorders and see this be recognized as a really serious and substantial therapy for bipolar disorder in this early research.
That's incredible. I mean, it's a great step in an important direction for sure. And some of the I'm really excited to be able to get the full-fledged findings, but what you're sharing so far is really encouraging in so many ways. And like you've said, this has been used as a metabolic therapy for 100 years for epilepsy. And we treat bipolar disorder with epileptic drugs. It makes a lot of sense. So you're kind of touching on some of the mechanisms, but I'd love to maybe dive a little bit deeper with you guys in terms of the mechanisms at play with the ketogenic diet specifically, and how they may be relevant to bipolar disorder. Because, I think the common thought is sort of, the cause, while they say they're not sure for sure what the cause is, it may be a balance of neurotransmitters or an imbalance of neurotransmitters, but there's so much more to it. So let's speak to some of those mechanisms that might be at play that is kind of tying the diet and the metabolic effects to bipolar, if you can.
I don't know if you ever bought this like neurotransmitter thing, Matt. I was always like very skeptical about this. What was
I'd love to hear your thoughts on that too. Yes. Experiencing it yourself. Yes.
I don't know. What are your thoughts?
Yeah. I mean, because the like SSRIs were kind of I was given an SSRI as my first line of treatment for bipolar, which I'm not sure if you're the same, but like obviously it's affecting neurotransmitter systems, and it's actually it could be really bad for bipolar disorder. It can cause you to go into mania. But my feelings from what we're finding, and this paper that I mentioned, I've just published a preprint about, is that the bipolar has been conceptualized as a kind of neurotransmitter imbalance for quite a long time. And this kind of seemed to happen in the 1980s when there was the development of SSRIs, and it was a very pragmatic approach of like, here's a tool we have to affect something, so let's really double down on this focus on neurotransmission because there's something we can do about it. And I think research can become quite pragmatic like that, where if we have a hammer, everything becomes a nail. And so, but what I've sort of mentioned is that there's a metabolic aspect to bipolar disorder that has been overlooked. And this is what this recent paper I published was looking at the roles of things like glutamate in the brain that have a metabolic aspect to them. So in this paper, I was highlighting that the original research of Hans Krebs in the sort of 1960s was talking about glutamate as a metabolic fuel source in the brain. And so I was proposing in this paper that actually we need to revisit the original role of glutamate in the brain that was highlighted early on in research. But it's always been, in most of the literature throughout the 1980s, 1990s, it was conceptualized in its neurotransmitter role, which is correct. But it also has a very fundamental metabolic role in the brain. And I think that some of the results we're seeing from our MRS studies are speaking to this alternate role of glutamate in the brain. And I think there's a number of aspects of bipolar disorder that have been misunderstood like that, or conceptualized in a different way to what the patient experiences. Like if you look at the early descriptions of the earliest description of bipolar disorder was by Emil Kraepelin, who was categorizing psychiatric illnesses according to different subtypes. And he said, his exact quote was that the lack of energy in bipolar disorder is very especially conspicuous. He was noticing in his patients that they were just not moving for long periods of time. And there's a real psychomotor activity aspect to bipolar disorder that's now kind of very much overlooked. And he also said that in mania, they work all night, they have endless productivity, they're able to function at a very high level. Sometimes obviously it ends in dysfunction, but they're able to exert energy and to exercise. So he recognized this as an energy imbalance and an energy dysregulation very early on, from the earliest days of bipolar disorder. And then mitochondrial research and circadian rhythm research has substantiated this over the past 100 years. So I think that on every level, from the earliest clinical observations to the molecular research and mitochondrial dysfunction research leading up to the recent brain imaging, I think it speaks to bipolar being an energy dysregulation disorder rather than a neurotransmitter imbalance disorder.
Yeah. Absolutely. And it's exciting to see that you guys are going to be contributing in a big way to further supporting what we're seeing in terms of energy imbalance and what you're seeing with patients specifically. Question for you, because one of the biggest things, I think, one of the biggest barriers within the research, or what you've heard since the beginning of even ketogenic therapy within the epilepsy field, is the diet is so difficult to follow. I mean, so much so to the extent where the diet is not offered as a first line of defense for somebody with epilepsy, right? Because it might be a little too difficult for the patient to do. So let's try drugs first, then we'll maybe keto as a last resort. I would maybe argue that's not the case. And the two of you being able to follow the diet, not only that, but you, Iain being able to implement it with a variety of patients. What would you say to that in terms of how challenging the diet has been to adopt, and for other people and patients out there who might be suffering, who don't even know it exists, but if they might be empowered to be a part of their treatment in that powerful way. So maybe Matt, if you want to speak to that process for you in following the diet. I'm not sure sort of what ratio or what type of ketogenic diet you were following. I know you were testing ketones and blood glucose, but what that process was like and how challenging it's been, and just any words to other folks thinking about it, or maybe who don't know about it, and considering giving it a try.
Sure. So I can speak briefly to this. I mean, the unfortunate truth is that a lot of clinicians will discredit this as a viable treatment because they'll just say, oh, well, no one's going to adhere to this diet. Yeah. And I think what they don't understand is that the suffering can be so tremendous and so terrible with this illness that people will literally do anything. Like if there's a chance that they're going to get well, and especially if people see evidence that they're getting better and feeling better, and they can actually point to the diet as the reason, people will adhere.
Yeah.
Like if it means getting out of depression, and it's not an easy diet to adhere to because the carbs are everywhere. You go into 7-Eleven, I'm like looking for something I can eat. It's difficult to find something. But at the same time, it's not that restrictive. There's tons of, I can eat meat, fish, avocados, all these fatty foods. I eat a lot of protein, and I eat a lot of food, and I eat a lot of fat. And I guess the only thing I can say is that in those moments of difficulty where I watch my friends drinking alcohol or eating a lot of carbs, and I want to, the rewards are so insane from doing this diet that it's worth any discomfort I have or any feeling of missing out. One of the most difficult things for me having to adhere to a diet like this has actually been not so much the taste of the food itself or missing that, but the cultural experience of having food with other people. So going out and experiencing the same food and having home cooked carbs, and everyone's tasting the same thing. And so there is an element of like FOMO that people probably have to go through while starting the diet and continuing to adhere to it. And I can only really speak for myself, but that has been a part of it. I make sure to always have a bunch of fatty food in the house so that if there's ever a situation, I can just go and eat that. But really, it's still a joy. I mean, there's something about eating well too that is just a joy and feeling good.
And fat does make food taste good, right? So there is that. And it sounds like you've kind of adapted over time. And like you said, the reward sort of outweighs any sort of amount of FOMO through the process. And I feel like you can kind of create things that, the sort of bad stuff in a ketogenic format, at least for the most part, right? So you feel like you're participating. But Dr. Campbell, I'd love to hear from your perspective, because you've got a very unique insight from both sides in not just, starting it or Atkins and then maybe transitioning into a more, ketogenic focus yourself, to helping, and researching with patients, implementing this approach as well.
Yeah, I mean, yeah, I totally agree with what Matt said about the suffering aspect of it, because it's like if you've, I don't know what the analogy is, but if you've fallen off the Titanic and you find a life raft, you're going to really hold on to that life raft no matter what. It might not be like, the best, the most pleasing diet you could ever eat, but you're going to hold on to that because it's saving you from a much worse circumstance. So I personally find it to be really enjoyable and satisfying and sustainable. And I think there's kind of good evolutionary reasons that humans probably ate a lot more like this. Maybe not everyone was completely ketogenic, but I think it was a lot more like this before the agricultural era and so forth. And so I feel like it is a sustainable diet, and it's a natural kind of human diet to eat lots of animal fat and to eat low carbohydrate vegetables and not eat massive amounts of sugar and wheat. So I feel it is very sustainable, and I think we've seen that in epilepsy, that if the choice is to have seizures or to eat this way, people will invariably choose to eat this way, and even very. So the people you think that might be the least disciplined, like certainly, having kids, I couldn't relate to that feeling, but like you'd assume that children might be the most undisciplined about this, but actually in every hospital in the UK, there's a children's epilepsy clinic that delivers ketogenic diet to thousands of children. And I think it's the same in America. And they stick to this over long periods of time, years at a time, up to, decades. And what's really interesting is some of them go into complete remission if they stick on it very strictly for 1 or 2 years. And I think when you're younger, that can happen. And I think it can potentially happen in bipolar, that in the same as epilepsy, if you do it strictly, you can heal this metabolic damage. Whereas if you're a bit older, I have to stay on all the time. But I think it's because I've sort of sustained more damage over time through having episodes. But I think people that are younger could potentially, there might be a possibility they could benefit in this way, where they do it very strictly for a couple of years and be able to go back to eating what they like.
Yeah, no, that's a really, really great point that you've seen with somebody like, Charlie from the Charlie Foundation, right? He went on the diet for a few years and then was able to eventually come off and not experience seizures like he was for all those years. So how has it been going since then for you both? You've been on, Dr. Campbell, how long have you been on the diet now?
About 7 years now.
7 years now. Okay. And you've been on it since 2021. So how has it changed? How are you guys managing now? It sounds like, Matt, you have some little bit more of a relaxed time during the week, potentially. I'd love to hear from you how that's changed over time and how it's kind of fit in as a way of life, really, at this point. Iain, you want to, or either or?
I'll go. So I have noticed that the one place I can get into trouble is if I'm out of ketosis for an extended period of time and then I come back in, and then the ketones go up very rapidly, and that can trigger some mood stuff. And so one of the things that Dr. Palmer recommends is that people watch for those first couple weeks when they're entering ketosis for the first time, because there can be some mood stuff for bipolar. Having said that, what I do now is I am in strict ketosis from Friday to Monday. I have only prepared food where I know that it's low carb and I know how much protein is in there and I know how much fat, and I only eat that from Friday to Monday, and I track my ketones over those few days, at least a couple times. And I'm typically in the 0.6 to 1.4 range for those few days. So it's pretty great. But then if something comes up, like I'm in the office Tuesday through Thursday, for example, and I want to have something with a couple carbs, so like almond butter, for example, I never have ice cream or rice or anything like that. But if I want something with a little bit more, I can have it. And I think I typically drift out of ketosis for those couple days, or if I'm on vacation for a few days, I never stop. I never eat real carbs in bulk. But if there's a few carbs in salad dressing or something else like that, I don't worry about it. But then what I make sure to do is I always come back to ketosis at least once a week or every couple of weeks, make sure I get the ketones up, make sure I'm still in it. And I've actually spent pretty extended periods of time out of ketosis since I did this. I never really ate carbs in bulk, but just having a ton of food, a ton of protein, carbs slip in once in a while. And I have this weird suspicion that I might be able to just go off it if I really wanted to, and I would be fine, but I just don't do it. I mean, it's just a lifestyle at this point. The metabolic benefits are amazing, and just feeling good, and the cognition and keto, and so there's no reason to. So I'm a little bit more relaxed, but I'm still pretty strict,
Finding what works for you. I think
that's right. And I think for everyone, it can be different. So I really don't think there's a one size fits all solution to using a metabolic therapy to treat mental illness. And we found this talking to all the different people who come on our podcast, is that people do keto very, very differently and have great success with it. And we just unfortunately don't know enough at this point to prescribe a real one size fits all solution, or even a set of specific solutions based on what symptomology a person has. We just don't know. So unfortunately, it comes down to like trial and error a lot of the time, and it has been for me. But people do it very differently and do great with it.
People absolutely, yeah, and respond very differently too. So I just want to mention, if you're listening and maybe suffering from a mental illness, super important to get started with something like this with a provider who understands metabolic-based therapies specific to mental illness. Because as you mentioned, Matt, like there can be some big shifts that happen. As you know, Dr. Christopher Palmer has discussed in his work in his book, Brain Energy. You really have to be very cautious about how you transition somebody onto a ketogenic diet or even off. So it sounds like you've gotten to such a great place, Matt, with like fitting this into your lifestyle and finding what works, and feeling good in the process. I think that's like got to be the biggest motivator to want to stick with it. I'm on a ketogenic diet just because it makes me feel so great cognitively, and you know, you don't really want to stray off from it, just feeling that good. So Dr. Campbell, I'd love to hear from your perspective, you know, where things are at for you, how you've kind of managed it within your life, and how things have changed over the last 7 years.
I would love to be able to come off it from time to time and be well. And obviously, we know from decades of epilepsy research that especially with young people, they can have this remission that means they can come off it for a time or extended periods. And I think it speaks to, I was at a presentation recently by David Unwin, and he was showing that in diabetes, the biggest predictor they had of remission of diabetes was how early they intervened. So if someone came in, with just as their blood sugar was going too high, they were able to reliably achieve remission in a significant percentage of those people. But if they came later, a few years down the line, it was much harder to get remission. They could get their blood glucose down and their insulin normalized, but it was much harder. And I wonder if this is the same with mental health, where if you, and with epilepsy, like we've seen many children go into remission and very few adults go into remission, like complete remission, where they then go off the diet and are well. So I'm unfortunately in the later, I'm an old person, and I have to stay on the diet constantly. And if I can come off it for a couple of days, and as long as I have ketones in my bloodstream, I feel well. But I do experience depressions again if I stay off the diet. So I have to remain on it permanently. But to me, this is the best deal ever. It's absolutely wonderful to be well. And there's nothing that would prevent me from wanting to be well for the rest of my life. So I feel confident about doing the diet for the rest of my life, and I have a great life whilst I'm in ketosis. So I think it just shows there's a different response maybe. And like Matt, you're quite, I don't know if, how old are you, Matt? No, Matt, I'm 36 now.
I'm 26.
Yeah, so like I've had 10 years more of episodes, and potentially that means I have to stay on it much more strictly and be in deeper ketosis, just like people with epilepsy who are older and have to do it, and people who are younger. And I think it's a really hopeful message. It's that if we could deliver this to young people, it might be a very, very effective preventative measure, just like it is with epilepsy. And I think that's the best thing you could hope for, is a measure that you could deliver to young people that would prevent them having the illness for the rest of their life. And people who are already had it for a while, we can manage it through ketosis and metabolic therapy to a point where we can live well. So yeah.
I think there are a lot of myths about keto too, unfortunately, and it has a bit of a bad reputation in the health and fitness sphere, or it has historically. And I think that's changing as we learn more about metabolism and metabolic health. But a lot of people think oh, you can't gain muscle, for example, or your athletic endurance is going to suffer, or you're going to get diabetes, you're eating all this fat, or your problems with cholesterol and LDL. And we're slowly learning that there are just a plethora of myths about metabolic health in general that have resulted in keto having a bad reputation. And it's actually one of an amazing thing you can do, I mean, for a lot of people to go on this diet. But yeah, for me, I mean, in terms of my experience of life and just being functional and having clear thinking, being functional in the gym, working out, it's been amazing. Like in addition to just like curing my bipolar disorder, basically, just the quality of life that comes with eating this way, it's worth being strict for me, at least like spending extended periods of time in ketosis, making sure I'm getting in it, making sure I'm getting the MCT oil, the fats, all the things that, that Iain talked about as well, that can boost the ketones and bump them up. The sleep is great. And the last thing I want to mention is that I did not go on the diet and then come off the meds in 3 weeks. So that the process of coming off the meds has been a long journey with a psychiatrist, doing this very carefully. And even though keto did amazing things for me, it's not like I was able to come off my meds in 3 weeks. So, this can be helpful, but it's not just like, it's not going to immediately, or at least for me, it didn't immediately fix everything.
Yeah, it's not an overnight fix sort of thing. You got to
No.
kind of be patient with it. I think you guys mentioned you started to feel the shift cognitively maybe, but the process to get to where you both are now takes some time, takes some patience, and takes finding what's right for you and your body, because everybody's metabolism is so different. Everybody's, situation is so different. So again, that's why it's so important to work with somebody who knows what they're doing, a dietitian or psychiatrist or what have you, in the process for sure. But you guys are just inspiring examples of just what can happen with ketogenic metabolic therapies. And thank you guys for sharing, because it takes a lot of courage to do both things, to go into unmarked territory with a nutritional therapy, thinking like, maybe this will help, not really having too much information around mental health conditions and ketogenic metabolic therapy, but then also being courageous enough to share that experience. So I have to say thank you. I'm probably going to say thank you multiple times in this interview, but thank you for doing the work that you are doing. And just being vulnerable enough to share. And Matt, I want to just touch on, I do want to talk a little bit more about your upcoming endeavors, Dr. Campbell, with research and where you're headed and where you want to go. But Matt, I want to talk more about what happened after you sort of shifted into remission, found such great success with the diet. Your family created this incredible, research fund, Baszucki Brain Research Fund, as well as this nonprofit called Metabolic Mind. If you want to speak to the mission of what you're all doing there and where you want to go in terms of elevating the field of metabolic psychiatry and this important research that's really happening all over the world, hence out in Scotland here and everywhere. So if you want
Yeah,
to
totally. So I wish I had my mom here, because she would actually be the better person to answer this question. And I'm not really involved directly in the work at Metabolic Mind, though I do help them out when they ask. But my family, was by my side throughout my illness, especially my mom, just researching every single treatment, every single medication, trying everything from TMS to sauna, just, everything with me. And my mom finally found keto, and we were so lucky. But the way we look at it now is just, and this is how my dad described it, in Santa Barbara, when we had the first metabolic health summit a couple of years ago, it's like a philanthropic greenfield. Like, this is the kind of opportunity that is rare and just such an amazing place to deploy philanthropic effort in a specific place, in a specific way. So the Baszucki Brain Research Fund is my mom funding research and the whole group funding research in metabolism and metabolic health and mental illness. So it's just been amazing. And watching, like, there's this really fun, like, cohort of, it's like a squad of researchers and clinicians and psychiatrists who are doing work in this field related to metabolism and mental health, of Iain and his dad, among, Dr. Sethi, Chris, a bunch of others, Georgia Eid. And my family, fortunately, has been able to bring this group together, people who are doing this work in isolation, bring everyone together and form this group to take on this challenge of battling the pharmaceutical industries and food industries and the ethos about using diets to treat mental illness, that a lot of clinicians don't want to do this. So it's just been amazing. So yeah, they're just funding the research, no one wants to give money to do studies about a diet with mental health. They want to do drugs. They want to do other things like that. So the fact that we're able to do this research now, and hopefully Iain's study among a bunch of others are going to come out, and we'll have a little bit of backbone to support this, along with all the anecdotal evidence and stories that Iain and I have encountered as well. It's just been phenomenal. And it's kind of lucky in a sense that this is the silver lining that this happened to me, is that my mom knows the illness and the process of being a mother so intimately. And she's just such an amazing person, but she's just, getting after it with doing this funding. So I think really good things are going to happen, not just for metabolism and mental health, but metabolic health research in general. This is just going to be like a tsunami in mitochondria. This is going to be a tsunami of information and, epiphanies over the next 10, 20 years. So it's really exciting to be a part of.
Well, your family is certainly accelerating this field, which it needs. What you were saying in terms of getting funding for this kind of work can be very challenging. And also researchers working in sort of silos and not, of course, when you're just so zoned in on your work, it's easy to not sort of collaborate and talk and share. And that's how Metabolic Health Summit was born, really to bring people together. And you guys are really doing this at an accelerated rate that I think is going to push the field forward in such a profound way, and just turning something that I'm sure I can't even imagine what your family's been through all of this, and to take something so difficult, so just hard, and turn it into something that's now going to help so many people is just nothing short of inspiring to watch. And we're so thankful for the support, of Metabolic Mind as well. And so thank you guys for what you're doing. And thank you for being courageous enough to share and talk to people and bring the right people in the room. So it's really exciting to see. And so, yeah, Dr. Campbell, I want to hear what's next. What's next for you? What's big picture? I know you've got, I'm sure, some places you want to go with this work. So I'd love to hear more.
Yeah, so I just wanted to echo what Matt was saying about that. This is, I think, like, why is this happening in bipolar disorder? Why are we seeing this kind of progress with the research? And I think that it's because bipolar is such an energy specific disorder. Is that you go from depression to mania, and if you go on any forum for bipolar disorder, you can see the pictures people post, and when they're depressed, their house falls into disarray, they can't move, they can't get out of their room, and when they're manic, they become hyperactive and they're cleaning and they're organizing their lives. And this is what Emil Kreplin was trying to describe in his very early clinical observations, is this is an energy dysregulation, that they have no energy and then they have an abundance of energy. So when you're talking about metabolic therapies, ketosis, and energy, it's really, you're answering the question that bipolar is posing. And this is the first time we've ever done this. We've always answered the wrong question about neurotransmission or some very specific dopamine receptor or serotonin receptor, and all of that is very valid and valuable research, but we weren't answering the core question of why are people not having energy and then having lots. So I think in this research, we've actually got the cat by the tail with bipolar a little bit, where we've seen an initial indication that this is really an energy disorder that responds to metabolic and therapies that affect energy and energy supply in the body. So what I'm excited about is from what we've seen in this early pilot research, we're seeing patients respond across psychiatric measures, across metabolic measures, and they're not having the side effects of the traditional treatments. And you can use this alongside the traditional treatments. So instead of the typical thing with bipolar is you go on olanzapine or one of the antipsychotics, and they can be very helpful if you're in hospital and bring you down, but you also put on 40 pounds of weight and your cardiovascular risk profile increases across the rest of your life. Whereas when we're doing this, we had, for example, people that were taking olanzapine and alongside that doing ketogenic diet and reducing their weight by 20 pounds and reducing their BMI and their blood pressure. And so I think this therapy speaks to both the cardiovascular risk of bipolar disorder and the energy dysfunction part of bipolar disorder. And that's that's the therapy we want for this condition, is things that can address both those aspects. So I would really like this to progress to an RCT, and this is what we're focused on now, is doing a randomized controlled trial in bipolar disorder. And this is because it will leverage the healthcare systems to provide this, and this might take some time, but it's a really worthy task because at the moment, the vast majority of people that live with bipolar disorder are in developing countries, low and middle income countries, where they have very limited access to treatment. We had Nomley, who was a lady from Nigeria on our podcast, and she was, I was talking to her the other week, we were just catching up, and she was describing that when she goes for mental health care treatment, they tell her to go on a bus and to find someone that they can talk to for 2 hours, because no one is going to listen to her about her problems. This is the way, like, the majority of people with bipolar experience the illness. And Matt was describing when we were in Miami, like the homeless situation, a lot of these people are people with mental illness. So I feel that we have to leverage the healthcare systems to get them to provide proper therapy to people with bipolar. And this is done through randomized controlled trials, but that's only 50% of the battle. In epilepsy, this has been done very effectively, but very few people are prescribed ketogenic therapy. So we also at the same time need this huge patient movement to demand this from healthcare providers, insurance companies. So I feel the combination of moving forward RCTs plus a huge patient movement will bring this about in a way that was much quicker than happened in epilepsy and on a broader scale. So I'd love to see RCTs, and I'd love to see a massive patient movement, and we're trying to work on both those things.
That's great. Yeah, no, I agree on 100%. You've got this movement happening from, obviously the research side is so critically important, especially randomized controlled trials, but also this patient movement too, like making it known to their providers, like, hey, we've not tried this. You know, I used to be involved in brain cancer research, and it was actually a patient who came to their neuro-oncologist and said, hey, why haven't we tried the ketogenic diet? And that's where we all got linked up and started, right? So that's where there's magic happens, I think, from both sides, where educating across the entire population, as hard and as daunting as that sounds, really doing the work and the necessary research, but all the way to educating the public and the providers is going to help us make some changes. So I couldn't agree more with that perspective. I'd love to kind of close out with some thoughts that you might maybe want to share with others who might be suffering, because you both have such unique insights into what you've experienced along the way with suffering from bipolar, but now thriving with ketogenic metabolic therapy. And, you know, Dr. Campbell, of course, with your perspective on both sides of the spectrum, what would you say to others who might feel maybe where you've been in the past, and that feeling of hopelessness and not finding control in the situation, but knowing what you know now with this therapy that's worked for you? Now, this is anecdotal, but what would you say to other folks who might be dealing with the same thing that you guys have been struggling with in the past? Matt, you want to go first?
Yeah. I have a little bit of a hot take, and I can only share my own experience. But for me, the most powerful things I've done in terms of recovering from this illness have been things that impact my physiology. So the main three, and the big three that have really cured me, have been keto, which has been the answer, but physical exercise, as well as circadian rhythm management, which means getting sunlight in the morning and wearing blue light blockers and adhering to a sleep schedule. And sometimes I think we get caught up in the meds and the talk therapy, and we lose sight of those three things that I described earlier: the sleep, diet, and exercise. And for me, the answer has been those three things. And, there's this thing called the Pareto principle, which talks about how sometimes in an endeavor, generally, the 80% of the success comes from the 20% of the most essential or most impactful actions. So for me and for people going through this, the way I think about it is, for myself, is that if I can just nail the sleep, diet, and exercise, and then take the meds as prescribed by my doctor, and then maybe you could throw in having a little bit of a community on top of that, I'm going to be okay. Everything's going to be fine. So most of my focus, even now, even to this day, is just on nailing those three components of my recovery. And I don't worry too much about other superfluous things that I've been exposed to, like art therapy or even traditional therapy, though I think I've done it and I think it can be incredibly valuable, obviously. But really it's sleep, diet, exercise, and I just try to nail those three things. And it's done wonders for me.
That's
It's
awesome.
done wonders for me just doing that. And I suspect that there are a lot of people suffering from this illness, bipolar disorder, who, if they could do the keto, the exercise, and the sleep management, the circadian rhythm management, could have incredible results. However, I will add that in a catatonic depression, it can be kind of hard to get up and exercise because there's literally energy dysregulation in the body. So telling these people like, oh, bro, you just got to exercise, like you're depressed, you got to, like, it's kind of ridiculous, obviously. So I think that for that reason, the keto can be the first component. The keto can come first. And then as the energy balance in the body and the system restores itself, sometimes exercise just becomes a natural consequence. The people have more energy. I'm on keto, I have ketones, then I want to get out and move. I want to get in the sun and sleep better. But for the people struggling, just hold on and give this a shot. You know, if it ideally under the supervision of a clinician, a dietitian, and a psychiatrist in a cohesive unit and a team. But please, just this, you know, this can really work wonders.
Yeah. And no, you made such a great point there, and just kind of first sticking to the basics, but also taking your time and kind of slowly getting into a rhythm with these things, because it doesn't happen overnight. And, you know, maybe starting with food first might be a great way. And then you start to feel better, and then kind of trying to get your sleep schedule on track. And, you know, it's kind of a ripple effect from there. But that was thank you for sharing those thoughts. And yeah, I would love to hear from you, Iain, just, you know, from, you know, others who might be suffering, but also maybe other researchers who are interested in this field, that, you know, from your perspective on that side of the spectrum as well.
Yeah, I just think this is one of the most interesting times to be involved in bipolar research and treatment, because we're learning really new things about the condition. And so I just recommend following the work of the scientists in this field, in this metabolic psychiatry community, people like Chris Palmer, Georgia Eid, Shivani Sethi, Daniel Smith, who's our head of psychiatry, my father, Harry Campbell. We published papers on this, and we're trying to understand. My fascination with bipolar is I want to be better from it, and keto has helped me to get there, but I also want to understand what it is. It's in my own neurons, it's in my own genetics, and I really want to understand what is this condition and why does it happen. And it's one of the odd things about bipolar is it's preserved very strongly in human genetics, and there's a consensus among geneticists that there's something that the human genome is trying to do with bipolar, and we need to understand what that experiment is trying to do is, and that will help us to also treat it and manage it better for people. So I think if you're researching this, try to be open-minded to these new perspectives, and if you're suffering from it, please hang in there, because I've been there in the worst possible states of this, and if you can just hang in there, I do think we're going to develop much more and better and effective treatments for this over the next 10 to 15, 20 years. So please hang in there and reach out for support from your family, and try to always have like one close friend or family member. And if you don't have that, reach out to bipolar support organizations, because there's always someone there waiting for you.
Yeah, that's a great point for sure. Reaching out to community, I'm sure, is so important in this process. And if either of you have any resources specific, I mean, you just kind of briefly touched on it, but anything, any place in particular, or anything else you'd like to say for the end of this chat, where people can go, or any thoughts you have in closing?
Metabolic Mind YouTube channel. Brett has just been crushing it, and the videos are amazing. So that, I would say, would be the first stop, as well as our podcast, if you want to check that out.
Of course, we'll link all of those. Yes.
We're not self-promoting, but it is good. We got lots of patient interviews. But yeah, I just want to say thanks for bringing attention to this through Metabolic Health Summit and through this podcast. Really appreciate your support, and thank you for having us on to talk about our experience.
Thank you.
Well, thank you both. It's been such a pleasure to speak with you. And again, you're a huge source of inspiration to us at Metabolic Health Summit and Metabolic Health Initiative. So thank you for just your work in spreading the word in education and in research. Truly appreciate your work, and very excited to see you both at Metabolic Health Summit 2024, which, if you don't have tickets, you can still get registration, metabolichealthsummit.com. That's going to be coming up January 25th through the 28th in Clearwater Beach, Florida. It's unfortunate it's right on the beach, right on the white sandy beaches, but we tried to put it in a decent spot. So it'll be a lot of fun, and I'm looking forward to seeing you both. And thank you again for the great chat today.
Sure. Thanks for having us on.
Thank you for listening to this episode of The Metabolic Link. If you like this episode, please subscribe, share it, comment, all the things, listen to it on all of your major podcast players. Please just help us spread the message of metabolic psychiatry by sharing this with others and also leaving us a review. That really helps us get into more ears and more eyes when you do that. And I just want to mention, if you've not got your registration yet for Metabolic Health Summit 2024, make sure you go snag it right now so you can see Matt and Dr. Campbell speak and also share some of those exciting findings within research. Dr. Campbell should have some really exciting things to share come 2024. And you can head on over to metabolichealthsummit.com for tickets. But make sure you grab them soon because we do sell out every year. I also want to mention that we have a medical education platform that's open to the public, but designed for the medical professional, offering CMEs for all of the content that we put out in the world. So from your video lectures at our conferences to one-on-one interviews to podcast episodes like this, even premium episodes that are not publicly available, you'll want to head on over there, as well as a ketogenic metabolic therapy ebook that summarizes sort of a year in review. We've got so many great resources over there. And we offer continuing medical education on that platform, just like our conference. So go to metabolicinitiative.com if you want more information on that. And until next time, thanks so much for watching and listening, and I'll see you soon.